Why do some people have visible tendons in their wrists? Have you ever noticed some people have tendons that stand out in their wrists? It can be quite fascinating to see. So, why does this happen? The answer lies in a muscle called the palmaris longus. This muscle is located between two other wrist flexor muscles. Interestingly, it is absent in about 10 to 20% of people, and this can vary based on ethnic background. When the palmaris longus muscle is present, its tendon becomes visible when you flex your wrist. You can see it clearly when you touch your thumb to your pinky finger. This action causes the tendon to pop up as a raised ridge on your wrist. If you do not see this tendon, it simply means you do not have the palmaris longus muscle, which is completely normal and does not affect how your wrist or hand works. The palmaris longus is considered a vestigial muscle. This means it has lost much of its original purpose over time as humans evolved. It provides a weak assist in wrist flexion and helps tighten a fibrous tissue in the palm called the palmar aponeurosis. Even though many people can see this tendon, its absence does not lessen grip strength or wrist movement. However, in some cases, it might slightly reduce pinch strength in certain fingers. Interestingly, the absence of this muscle varies across different populations. It is less common in Asian and Black populations and more frequently found in Caucasians and some other groups. From a medical perspective, the palmaris longus tendon is often used by surgeons for tendon grafts. It is easy to access and removing it does not harm hand function. This makes it quite useful, even though it is not essential for most people. In summary, visible tendons in the wrist are usually the palmaris longus tendon showing through the skin during specific wrist movements. Whether or not this tendon is visible depends on the presence of this muscle, which varies from person to person. This anatomical variation is a curious reminder of our evolutionary history and the uniqueness of each individual.